Have you ever found yourself thinking about wet dreams, who experiences them, why they happen, and what they actually mean? Well, I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm here to walk you through all of that. If you're new here, I create content focused on urologic health, bladder health, sexual wellness, and much more. So if you enjoy what you see, be sure to subscribe and share this channel with your friends. The medical term for wet dreams is nocturnal penile emissions, but most people simply call them wet dreams or nightfall. In simple terms, it's when ejaculation happens during sleep and you wake up to find a bit of a mess on your sheets. Interestingly, this can occur in both men and women. But before we dive into why this happens and what it really means, let's first understand what takes place in the body during ejaculation. Typically, with sexual stimulation or physical friction, the body sends signals through the sympathetic nervous system, the system that activates during fight or flight responses. This is when adrenaline starts to rise, triggering that system into action. These signals travel to the spinal cord, which then instructs the bladder neck to close. This is important because it ensures that semen moves forward through the urethra instead of going backward into the bladder. Next, fluid is released into the urethra from the seminal vesicles through the ejaculatory duct, something I've explained in more detail in a few of my other videos that you're welcome to check out. This fluid, once in the early part of the urethra, triggers a reflex. That reflex sends another signal through the spinal cord, causing the pelvic muscles and the muscles surrounding the urethra to contract. These contractions then push the fluid out through the urethra, resulting in ejaculation. So, who actually experiences wet dreams? Based on smaller studies, about 80 to 90% of men report having at least one wet dream during their lifetime, while roughly 30 to 40% of women do as well. Interestingly, there hasn't been extensive research on this topic, but what we do know is that up to 48% of men who experience wet dreams, often starting around puberty, have no idea it's going to happen and never discuss it with anyone. And you can imagine how confusing or even frightening that might be for a young boy, waking up to a sticky mess in his bed, unsure whether he had an accident or what exactly just occurred. Most commonly, people experience wet dreams during puberty, and there are several reasons for that. However, they can actually occur at any stage of life. A number of factors play a role, including your age, how often you ejaculate, and your hormone levels. In fact, if you haven't ejaculated for a few weeks, the chances of having a nocturnal emission may increase. You might assume that wet dreams only happen when you're having an erotic dream, but that's not always the case. Studies done on small groups have shown that up to 40% of men were either having completely non-sexual dreams or woke up without remembering any dream at all when the emission occurred. So it doesn't necessarily mean you were having an erotic dream. It could also be related to physical factors, like pressure or friction in the area. For example, if you were sleeping on your stomach, or other similar triggers. This is entirely normal. Whether you've experienced it or never have, there is absolutely nothing wrong with you. Let me emphasize that again. Having wet dreams or nightfall is not harmful in any way. It does not affect your overall health, your sexual health, your fertility, or anything else at all. The purpose of this video is simply to reassure you that this is a natural process. Nothing to worry about, and certainly nothing to feel embarrassed about. And as always, remember to take care of yourself, because you truly matter.